Saving the world's women from cervical cancer. Data personal. School of Nursing San Vicente de Paul. Data person. My name is Joana Ruiz López. Teacher Licenciado John Moscoso. Issue applied in Ecuador. According to data to date from a study genotype 16, 53, and 58 of human papillomavirus were found to predominate in women on the Equatorial coast. In addition, 20 of 100,000 women have cervical cancer in the country. In most of these countries, cervical cancer is the leading cause of cancer death among women. Definition: cervical cancer is a malignant tumor that begins in the neck of the womb and is more common in the women of the age of 30.
Cervical cancer is a cancer affecting women, and the number of patients increased in recent years. Of all patients with cancer in Indonesia, a third of patients with cervical cancer. This cancer is a scary killer for women. Obtaining information about this cancer can help more women to avoid one of the most deadly diseases. Cervical cancer is one of the diseases most common cancer for women. Every hour, one woman died in Indonesia because of cervical cancer. Fact is that millions of women in the world are infected with HPV, human papillomavirus, which is considered sexually transmitted diseases are most common in the world. In Indonesia, every 1 hour, one woman died of cervical cancer, according to the World Health Organization. This infection is a major risk factor for cervical cancer. Every year, hundreds of thousands cases of HPV are diagnosed in the world, and thousands of women die from cervical cancer, which is caused by the infection. Given the fact that this horrible, the various measures, prevention and treatment have been made to address cervical cancer. Cervical cancer occur in the reproductive organs of a woman. The cervix is the narrow part at the bottom of the vagina and uterus of a woman. In part, this is happening and the growth of cervical cancer.
Application in the nursing. According to OMS, recommends the guidelines administered to girls between the age of 9 and 13 to those of the human papillomavirus vaccine to prevent infection with the cervical cancer virus in most cases. Use HPV screening method to prevent cervical cancer. Communicate with a wider audience, adolescents, parents, educators, leaders, and the health professionals as the leaders so that women receive information at all stages of their life. Pros and the cons. Although cytology is an effective test to prevent cervical cancer, two screening tests has an accuracy of 100%. Cytology might not identify lesions that aren't present different reasons. The some are scored from and the area with lesion and the those not contain abnormal cell, and although there are abnormal cells in the cervix, some samples contain blood or mucus, and the cells do not look well under and the microscope. Some lesions are deeper and they cannot be sampled from those areas.
A cervical smear is an internal examination which is primarily done for early diagnosis of cervical cancer. Women between 30 and 60 years of age are advised to make a cervical smear for screening purposes every 3 years. A cervical smear can be made by your own general practitioner. Often it is the assistant who performs the examination. First, they will go through a questionnaire with you. To make a cervical smear, you will lie on an examination table with a bare lower body. The assistant will need a speculum to perform the cervical smear examination. Before the examination, the speculum will be brought to body temperature by warming it with warm water. Then it is brought into the vagina and the speculum is opened. The walls of the vagina are spread and the cervix becomes visible. The assistant uses a brush to remove some cells from the wall of the cervix. The brush is put into the cervix through the speculum, where the cells are removed with circular movements. Mostly, this examination does not hurt. You can have a slight sickly feeling when the speculum is put into the vagina and during brushing. After removing the cells, the examination is done. The assistant will tell you how and when you can expect the results. Sometimes some blood comes out of the vagina after the examination. That is nothing to worry about. The removed cells will be sent to a laboratory where they will be examined through a microscope for possible anomalies. In case of slight anomalies, a new cervical smear will be performed within a few months to a year. These anomalies can go away on their own. When there are more severe anomalies, further examination needs to be performed, and you will be referred to a gynecologist.
Conclusion. Cervical cancer is high incidence and mortality. This is more frequent in women of low socioeconomic level with active sexual life and a high mortality. This cancer is strongly associated with the early age of first intercourse and the multiple sexual parties in both women and their parties. Thank you.